Today we're talking about wound care. It is a large portion of our practice, and a handful of doctors specialize in this specialty. Roughly about 30 million Americans suffer from diabetes. Roughly from that number, about 15% will actually get a foot ulceration, and out of that population, about 10 to 25% will actually develop an ulcer so bad that it will require either a digit amputation, partial foot amputation, or lower leg amputation. The reason why patients tend to get ulcerations is that they have compromised circulation as well as compromised sensation. This means they cannot feel things as well as somebody who is not diabetic with neuropathy, which can cause them to step on objects that can either cause a break in the skin or cause enough friction to ulcerate the skin and open it up for a possible infection or something worse. Common areas where this can occur are at the PIPJs of the lesser digits, also at the first MPJ, the fifth MPJ, and the heels for patients that are bedridden. Other common wounds that we see in our practice are arterial and venous insufficiency ulcerations. Arterial tends to be those that have compromised circulation. These wounds tend to also happen on the inside and the outside portions of the ankle. The reason why patients will get these is they do not have enough blood flow getting to the tissues to sustain the tissue, which will cause a area of breakdown, which will cause an open sore. These also tend to be quite painful, as these patients are not typically diabetic. It's more because of compromised circulation. Venous insufficiency wounds tend to be a little bit more difficult to treat. They tend to happen on the inside and the outside portions of the legs. These people also tend to have quite painful wounds because it's not because they're insensate, it's because too much fluid is building up in the legs, and it eventually will wear down the skin and the tissues to cause an ulceration. They're also difficult to treat because they tend to have quite a bit of fluid leaking from these wounds, which also makes it difficult to control in the wound care process. Some of the things that I tell my diabetic patients is to make sure they're checking their feet out daily. This will make sure that they can see any changes to the bottom or tops of the feet where areas of redness occur, also new ulcerations that are developing, so that way they can get an appointment with us, so that way we can tend to the wound before it becomes too problematic. In terms of arterial ulcerations, the first thing we do is we work with vascular surgeons very closely to evaluate the problem and hopefully reverse whatever is causing a blockage. In terms of the venous ulcerations, we also deal with compression to make sure we control the amount of fluid building up in the leg, which also in turn will allow the body to be able to heal the wounds